That first year of a baby's life, wow, it is just an incredible, non-stop blur of growth. And if you're a new parent, it's this amazing mix of constant wonder and maybe just a little bit of worry, right? So in this explainer, we're going to pull back the curtain on how pediatricians track all that amazing development. We're giving you a peek inside their professional guidebook.
I mean, think about it. This is the single greatest period of growth a person will ever experience. In just 12 short months, they go from a tiny, helpless newborn to a babbling, cruising, almost toddler. It's just astonishing to watch. And with every single new change, it's totally natural for parents to ask one really big question.
You see them changing before your very eyes, but how can you really be sure it's all happening the way it should? How do doctors know the difference between what's just a normal variation and what might need a closer look? Well, it turns out there's a real method to the madness.
Before we even get to the fun stuff, the milestones like sitting up or saying dada, we have to understand the 4 core principles that guide every single pediatric checkup. You can think of these as the fundamental rules of the game.
Okay, so first up, development follows a predictable path. A baby will always get control of their head before they get control of their trunk. It's a set sequence. Second, and this one is huge, the range of what's considered normal is incredibly wide. Third, lots of things matter, not just physical health, but their social world, their environment, everything. And finally, a doctor's exam is tailored to the child's developmental level, not just how many months old they are. Let's just hang on that second rule for a second, because this is the one that can help parents breathe a little easier. Development is not a race, not at all. Kids mature at their own pace, and that variation between them is completely, 100% normal and expected. All right, so with those rules in our back pocket, how does doctors actually measure all this progress? Let's open up the toolkit and see what's really going on during one of those checkups. They're basically tracking progress across 4 key areas. First, you've got physical skills. That's the big stuff like sitting up, but also the small stuff, like grasping a toy. Then there's cognitive, which is all about problem solving. Language is pretty self-explanatory, it's all about communication. And finally, social-emotional, which is how they form relationships with you and the world. Now, to get a quick snapshot of how a child is doing, clinicians might use a screening tool called the Developmental Quotient, or DQ for short. Just think of it as a standardized way to see where a child is on their developmental path compared to typical timelines.
So how does this thing work? The formula is actually really simple. You take the child's developmental age. That's the age most kids can do a certain skill. And you divide it by their actual age. Multiply that by 100, and you get a quick, standardized score. It's just a snapshot.
And here's what those numbers mean. Anything over 85 is considered normal. Below 70 might point to a delay. But the really important part is that zone in the middle, between 70 and 85. That's not a red flag, it's not a panic button. It's simply a, let's keep a closer eye on this button. It just means it's an area to watch with a bit more follow-up.
Okay, let's make this real. Look at the kid on the left. They're 12 months old, but they're showing skills more typical of a 10-month-old. Their DQ score is 83, right in that gray zone. So, no big deal, just needs close follow-up. Now the kid on the right is also 12 months old, but their fine motor skills are more like a 7-month-old's. Their DQ is 58, and that clearly signals a delay that needs a closer look. Okay, now for the part everybody loves to see, the milestones. Let's take a quick trip through some of the biggest and best skills that pop up during that incredible first year.
This chart right here, it's basically the roadmap for the whole first year. You can see how all those domains we talked about, gross motor, fine motor, language, social, all progress together. It perfectly shows that predictable pathway. Now, we're not going to read every single box, but let's zoom in on a few of the greatest hits from this journey.
So the journey starts small, but it is so important. By the end of that first month, during tummy time, you'll start to see them just begin to lift their chin. It might not seem like much, but it's the very first step in gaining that crucial head control.
Now let's jump to a huge social leap. Around 4 months, you get one of the greatest rewards of being a parent, the social smile. This isn't just a random reflex anymore. This is a real smile. In response to you, it's a foundational moment of connection. It's the best.
By 9 months, things really start to take off. They are on the move. This is when babies often pull themselves up to stand, start cruising along the furniture, and you might even see the hilarious bear walk, crawling with straight arms and legs. Their whole world is just opening up.
And that first year often ends with a grand finale of two iconic achievements. Right around their first birthday, many babies take their first wobbly, independent steps and say their first words with real meaning, like mama or dada. It's just a mind-blowing transformation from where they started.
So we've seen the what and the when of development. But how do clinicians actually find all this stuff out? Let's go behind the scenes of the physical exam for a perfect example.
If you've ever so gently touched a baby's head, you've probably noticed the fontanelles. We all know them as soft spots, and they're simply gaps where the skull bones haven't quite fused together yet, which is super important because it allows their brain to grow.
So why is your pediatrician always so gently feeling this spot? Well, because it gives them vital clues about the baby's health. A soft, flat fontanelle, that's what you want to see. But if it's sunken in, that could be a sign of dehydration. And if it's bulging, it could indicate increased pressure inside the skull. That one simple touch tells them an incredible amount.
All right, so far we've been focusing a lot on the clinician's point of view. But the most important person on this whole journey isn't wearing a white coat. Let's talk about the absolutely critical role that you, the parents, play.
This quote from the source material just says it all. The partnership between parents and pediatricians is everything. A doctor can give advice and do checkups, sure, but it's the parents who are there every single day, promoting health and putting that advice into action.
And the best part is, health promotion isn't some complicated medical procedure. It's the simple, loving things you're already doing every day. Playing with your child, talking to them, singing, reading books, these are the powerful, fundamental things that build healthy brains and support every single area of their development.
So, in the end, tracking these milestones isn't about nervously checking boxes off a list. Not at all. It's about understanding and appreciating the incredible, predictable, and yet totally unique journey that every single child takes. It's about being an informed partner in their health. So the real question isn't what box they'll check next, but what amazing new world will your child discover tomorrow?